And welcome back to 99 Shades of Pain show and podcast. So, today's episode, today's talk is going to be an interesting one, controversial one, if you will. But before I get to that, I just want to emphasize what this podcast and what the show is really about. This show and podcast is really about educating you, the person who's listening to this. It's really about empowering you with the right tools to navigate through your pain journey so that we can get you to a better place. And when I say we right now, I'm talking about we in the collective medical space, making sure that you find the right providers, making sure that you find the right answers, making sure that you are in the right place at the right time. That is what this really is really about. On the side, if there's a bonus that we get to make you laugh, even better. But this is really about education and empowering you, the person listening to this, to make the best possible choice for your own health.
Should,
And with
should,
that,
should we do a comedy show one day to make people laugh?
you can do a comedy show. We can break it off from this channel. Huh? How about that? You can do a comedy show.
Just like 15 minutes of stand up.
Do it. I mean, you got 15 minutes of original material every day.
I do
If
not.
so, let's get it done.
That is not
Get it
one of my
done,
skills.
Sorry, we'll form new ones. Oh, we live and grow. But maybe you can prep a joke for the very end. Yeah?
Yeah, no.
Cool. Great. Sounds good. So today's episode, right? How a simple visit to the chiropractor could spell disaster. It could, or maybe it couldn't. We're going to talk about it. So first of all, I just want to start off also by saying that a lot of people think that physical therapists and chiropractors have beef with each other. And that couldn't be further from the truth because, it's maybe only the bad ones have beef with each other. They're trying to play a game of who's worse. But to be honest with you, I have no problem with chiropractors as long as they do the right thing. All right, same as a physical therapist. Right, I have a beef with PTs if they're doing the wrong thing. Now, the right thing and wrong thing is very kind of relative, right, and subjective, with one exception being the patient and their results, right? And results, by the way, not just feeling better for a day or two, but actually feeling better long term. That's the result that we're after. Temporary results, short-lived, short-term results, they don't matter. They're not real, right? They're wins, but those short wins need to be extended to long period wins. Now, chiropractors and physical therapists, funnily enough, actually share the same job. We do the same things. Physical therapists can also adjust people. That is in our skill set. Right? There are courses where we could do that, where we could learn that. We do learn it in school. I don't do them because there's no need to do them. Same as I really don't use my hands all that much either. There are certain manual therapy techniques that I use if needed, when needed, but the big thing being if needed. But chiropractors are technically supposed to be doing the same things. We use manual skills if we need to, but we both are supposed to give a progressive movement program to the patient that we're seeing. Now, when you think of chiropractor, Eric, what do you think?
Crack, crack, snap, snap.
Crack, crack, snap, snap. That's right. Crack, crack, snap, snap. And then the usual, oh, wow, right? Post-crack.
Sometimes no. I mean, I've been to the chiropractor before, and there have been times where it's like, snap, oh shit.
Right.
Well, I'm not supposed to use bad words on this show, but yeah, sometimes like that crack doesn't always give you that feeling of release, and you will limp out of the office like, what just happened to me?
Yeah. Right. And that's really where this conversation is going to go in just a moment, where, not everybody should be getting cracked and adjusted. Right. And we said this on yesterday's episode, but adjustments aren't actually adjusting anything. They've done studies and imaging studies where they've done, someone's done an adjustment live where they're seeing what happens internally as the adjustment's being done. and the movement that happens within whatever that's being adjusted is like fractions of a centimeter, and then whatever movement did happen, that it just slides right back into where it was. There's no adjustment happening. In fact, it's more of a neurological response than it is a physical one. Now, same as other manual therapy techniques, most manual therapy techniques provide a neurological benefit, right? Yes, can there be increased blood flow? Sure, maybe, possibly. But what it's really doing is having a neurological impact and a psychological impact on the person that this technique is being done to. Now, to solidify, if you want to think about it like this, where let's say the adjustment, the manual therapy techniques, whatever we use in our repertoire, imagine it's the jackhammer to breaking down old cement, and you need to lay down new cement, right? So you break down the old cement, but then imagine this: so if someone who does just the adjustment, right, just a crack whack or just like some massage, which also doesn't do anything. Imagine someone did the jackhammer, right, on a busy highway, did the jackhammer, the road is crumbled, and just says, okay, done, walks away, and then just have broken road everywhere.
Danny,
right?
We live in New York City. That's what they do. They jackhammer the road. It's unfinished, unpaved. Every road is broken and messed up. That's literally our streets.
Well, there you go. That's this is for people who don't live in New York and don't know the struggle. But essentially, it's like doing that and just walking away. The job is not finished, even if temporarily, like, you have relief. Oh, okay, the old road's getting broken down. Great, but no new road is being placed down on the road, right? So it's still bumpy. It's relieving because the old one's broken down, but it's still not finished. And so that's the main problem that I have with chiropractors, with PTs, who don't do that next step of the process because they're doing you a massive disservice. They're just continuously breaking down the road, but not building a new one. The only way to truly build a new road is by, again, establishing a progressive and appropriate movement program to get you from point A to point B. This is the biggest thing I see. I see so many patients who've gone to the chiropractor for weeks and months and years, but yet the problem persists. But yet the pain is still there. And maybe they're not exactly where, if there was someone was in a very, very bad place, chiropractor got them up to this place, which is amazing. Again, that is awesome. Really, really, really good. But from bad place to medium place, we need to go to this place. But this person has been treading water, right? That's a perfect example of not enough is being done. And I see so many patients like this, and it freaks me out because people are spending so much time, so much money, because a lot of chiropractors also are not necessarily covered by insurance, or if they are, a lot of people still have a copay. But if you figure 30 sessions, even with a $20 copay, I'm no mathematician, but you're still coming out to what, $600, right? $20, 30 sessions, $600. Sounds about right.
Seems right.
Oh, nice. Yes. Yes. But you're still coming out to $600 down the line. And for what? If you're paying money, right? Like, I ain't cheap either. But if you're paying money, you expect to see a result. You expect to, again, just keep climbing the ropes of success. You don't expect to keep plateauing, right? So whether it's a $20 copay or a $300 visit or a $500 visit, what are you actually getting? What is the value from those resources? Again, money you can make back, time you cannot. And time is actually the biggest one, because time is every day that you continue to be in pain is another day you continue to be in pain. And time compounds. Right before you know it, it's 6 months down the line, and that little back pain is still there. Better than where it was, sure, maybe, but you've been plateauing for the last 6 months. And that creates a massive problem. This is why people stay in chronic pain. Again, the chiropractic adjustments, they may feel good, but if they are not followed up by some kind of progressive movement program, one that changes over time as well, you're not in the right place.
So
Period.
I had a, when I like first had my disc herniation, I did go to a chiropractor as part of my overall treatment plan, and I think I actually went to a good one. it's unfortunate. He passed away a few years ago. Old guy, like specialized in herniated disc. That's like what he did for most of his career. Uh, and I remember when I came in there, it's kind of similar to the PT. So like first I'd lay down on some table, they'd warm me up with some electric stim, some heat, and that was like the warm up. After which and then I'd go down the hallway, into a pretty small room where I'd lay down on the chiropractic table. And I think the magic of what this guy had, part of it was this table. It was some kind of special table that like you held on with like a vice grip to the very front of it, and then it would like collapse down, and he would like keep his hand on your back, and for lack of a better word, like pushed your discs along with the table back into its place. Um, so over a series of, I don't remember how many treatments I got, probably like 10 or 12 visits, he was like, okay, you're done. You don't need to come see me anymore. Like, and I was shocked when I heard that. He's like, that's it. That's all. I can't do anything anymore. But I felt better, and I didn't have that movement plan, Danny, that you were talking about. So like I got a worksheet with some basic exercises, which I did, but it kind of kept me in that same place. So like after the pain got better, I had pain going down my leg and I had some drop foot. So like those symptoms improved a bit, but they stagnated. They stagnated and
Yeah.
they didn't improve. So and again, I thought that the chiropractic experience that I had was pretty good for the time that I was in it. Is what I just described, is that pretty typical, or can it get even worse?
Of course, it could be worse. And I'm going to break your brain in a second too, because disc herniations are very special injuries. I'm going to break your brain in a second, but um, since we're on the topic of disc herniations, I'm going to tell you now. I have had patients who have gone to a physical therapist, and the beginning has been relatively the same. You come in and get those hot packs, cold packs, but then the adjustment comes, and I've actually had a patient who came to me almost directly after going to a chiropractor, because when the chiropractor did the adjustment, again, typically when you go to you say, okay, I got disc herniation, I have low back pain, and they will typically do the same damn adjustment thing that they do across the board. May vary a little bit by segment, probably, depending on where the disc herniation might be. But generally speaking, the adjustment process is really the same. It's the same copy paste, rinse, repeat kind of deal. So the chiropractor did the adjustment, and then her symptoms got way worse. The symptoms spread, became more intense, became more painful. Sleeping was now a problem. All those things became a problem. Then I had another patient, had a cervical disc herniation, and also he went to a chiropractor, got an adjustment, and the pain, like he had already had pain for a while, and the pain was originally down the arm. Then naturally it receded to where it was only really painful in the neck and shoulders. Once the chiropractor did the adjustment, the symptoms restarted right away. Just right back down. Everything got worse. Couldn't sleep. Couldn't stand. Couldn't do his job. It became very, very bad. And that was terrible.
Do you have any idea why that happened? Why those?
Because these kinds of treatments are not a one size fits all, and this is the big problem, right? Again, 10 people walk in with low back pain. Do all 10 people need adjustments? Really? Really? I don't think so. Can an adjustment be harmful? Yes. You're doing a high thrust, high velocity uh, adjustment, right? It's a force, right? If I punch you, right, there's a certain amount of force going from my fist through your shoulder, and then the force enters your arm, and stuff happens depending on how hard I hit you, right? I can tear a ligament depending on where and how I hit you. I can break a bone depending on how hard and where I hit you. A lot of things. I can just give you a bruise, a hematoma. I can burst some blood vessels and cause you a bruise. a lot of things can happen. And if you are doing an adjustment on the wrong person at the wrong place with the wrong strength, with the wrong angle, you can cause problems. That patient who came with the disc herniation in the low back, and he woke up her symptoms, that there should have been no adjustment done. All right, and now also to break your brain a little bit, with disc herniations in particular, everyone has a natural time frame of when they start to get better. No one's hands are that magical that they can push a disc back into place. That's not a thing. That doesn't happen. And what that table was doing was it was creating a range of motion that was passive, right? Because you were holding onto the thing, right? But what the table was doing was by dropping it down from under you, it was creating an angle of opening through your spine, which can either relieve or cause more pressure, which is the crazy part. A lot of people say, okay, if you have a disc herniation, there's angles that you should avoid. Not true. For some people, bending forward might be better. For some people, bending back might feel better. All right, I've had people like this all the time.
Well, is that kind of similar to spinal traction?
So spinal traction also, it'll either make you feel better or make you way worse.
Because there's a lot of clinics now promoting like, hey, we've got these spinal traction machines, and for anybody listening that doesn't know what it is, it's basically like a machine that kind of pulls you apart like little by little. Yeah, at least it should be very controlled in a very specific way. And it's supposed to create that relief that, like kind of like stretching out your spine.
Yeah. But for some people, that is highly, severely pain provoking. Like, so again, it'll go one of two directions. Either it'll make you feel good or it'll completely wreck you. And I'll give you another example. I had another patient. He went to a chiropractor, and he also had a cervical disc herniation. And he was feeling better again on his own. He went to a chiropractor that did the adjustment and then combined it with the actual inversion table, and bad, really bad, really, really, really bad symptoms began right after that very first session. So again, like all these things, which is why I also don't particularly like them. In the beginning, I was kind of on board when I was first entering the PT world. I thought, okay, it's cool, inversion table is cool, all right, this is cool. But as you kind of dive in deeper and deeper and deeper, and understanding, I work with chronic pain mostly. Sometimes I see fresh injuries. I love working with fresh disc herniation injuries, just because how you manage that journey in the beginning is very important. But like I said, disc herniations will take their own time to heal. You cannot focus on the disc herniation. What you need to focus instead on is the motion around the disc herniation and the nerves as they go out of the disc herniation. As soon as there's a nerve impingement, different signals go down the chain, right? Weakness begins, atrophy begins, nerve interruptions at the foot begins, depending on how severe the disc herniation is. But what you need to focus on is the motion of the spine, which is, again, with the table, when you drop the table, you're creating a motion at the spine, right? There's nothing being pushed into place, nothing being forced back into place. Like you said, he was a pretty old guy. I know who you're talking about too. He is not strong enough for that. Even if he was, like, it doesn't happen. But he's definitely not strong enough to do that.
Oh no, he basically like had to sit on me to like crack me.
Nah, that was just, again, leveraging the angle in the spine. Right? That was one of the worst things you can do with disc herniation injuries is nothing. The more you do nothing, again, that pressure is on the disc. You need to vary up the position to have some form of relief upon the nerve channel. Right? That's what usually gives relief and what helps to mitigate the pain signals coming from the injury to the brain.
I know there's some people that also have questions about inversion tables, and a lot of them are marketed to like for a lot of different purposes. So I actually got one for my back, and Danny, I don't know if you remember, I'd get on this inversion table every single morning and night, usually like before I'd go to work and after I come back from work, and I'd go down, and every time I do it, I get this click. But what ended up happening was I ended up pulling basically my leg out of its socket. And then Danny would have to realign and reposition me. So when I'd pop my leg out, it would cause all kinds of muscle spasms. I was like standing at like a 45-degree angle, like crooked, lots of pain. And like if you do things on your own, unsupervised, like I don't know what other issues I had that caused that, but never again am I using another inversion table.
Again, all these tools, right, especially ones that leverage your weight, you got to use it with a grain of salt, right? Like, it may be the best thing for you, and even then, for a short period of time, right? Like, it was all good until it wasn't, and or it might be the worst thing possible for you, right? Simply put, right? But going back to the whole chiropractic thing is, if everything is just being done as a one size fits all, it ain't it. It's not. That ain't it. You cannot be treating the same way for similar conditions, right? I always tell my patients, I can have 20 people just like you walk through my door. I'm going to treat all 20 of you completely differently because you're all 20 different bodies. You may have pain in the same area, but you may have 20 different causes of the pain. There may be 100 different things that are involved because of that pain, right? For some people who have shoulder pain, they have neck pain. For some people who have shoulder pain, they also have chest pain. So some people, they have shoulder pain, they also have low back pain. There are so many things that happen, and you cannot treat people the same. There's the same, again, my beef with PTs who run these insurance-based places, not every place, but a lot of them, a lot of the places where my patients come from, and everyone just put on a damn rotation, round and round we go on the merry-go-round, and it doesn't help people because it's not specific to the individual. This is the biggest problem, right? This is the biggest problem with the whole medical system. There is not an opportunity for many places across the medical spectrum for people to spend the time and the energy and just have the availability of time to appropriately diagnose, appropriately treat, appropriately guide and advise and help build up. These things don't happen. And this is a very big problem within the medical space because this leaves you, the patient, right? And Eric, you have been the patient, kind of left out to dry and kind of on your own, and this is a big contributor, again, to the whole chronic pain space. People are mostly in chronic pain, not because of their inaction, but because they're not given a chance to do the right action. They go to a place where they think it's going to help them. And in fact, again, it may, like with the chiropractor example, they may bring them out of the really deep pit, maybe, but there's no progression. There's just flat line, right? Or the chiropractor is the worst thing for them. Or the PT insurance-based place that they went to is the worst thing for them because, again, they're just going round and round and round and round, and the insurance is just being bled dry.
So for a lot of chiropractors, you mentioned at the beginning that, a lot of them are out of network. There are some in network chiropractors, but there's a good amount of out of network or have higher copays. So a lot of people are actually going to the chiropractor and paying cash. So in those situations, wouldn't it make sense for that provider to also spend more time with you to give you the proper diagnosis and the proper treatment?
I mean, yeah. Yeah. Again, whether they do or they don't is a different story, but I mean, the question is sound.
I mean, yeah. So it's at the beginning you also mentioned that PTs and chiropractors have like very similar skill sets. So this warning is not just for chiropractors; it's also for PTs that do adjustments, and that PTs that can do the wrong treatment for the wrong or right diagnosis that can also cause immense damage to you.
Yeah, exactly. If you're taking a shotgun approach to treatment, or you're doing the wrong treatment for the wrong person, that can cause serious damage. That can cause serious harm. And when this kind of treatment process is occurring, it's like, again, it either does nothing for you. It either, you might be the lucky person where your injury is relatively simple in the sense of like all you really need is just to move in some way, right? So like if 100 people go to physical therapy, and let's say out of that 100, 40, they just need to move their body. They just need to do something to help them with their pain, right? So for 40 people, let's say regular traditional physical therapy, chiropractor is enough. What about the other 60? Or what about the original 40 down the line, right? Because if they're only moving in PT, there's no lifestyle changes, which is something I really try to focus on with my patients. There's no education, which is something I really try to focus on with my patients. There's no changing of bad or old information that people have either grown up with or been told as they grow up. If there's no change in that old information, that is not going to be conducive for them down the line. Right. There's a big misconception. It's like, like for working out, right? I don't know if you've ever heard the term, or if anybody that's listening has heard the term, bro science, right? Bro science is essentially workout advice or tips that has no scientific backing. It's just been handed down from one bro to the next bro to the next bro to the next bro. And you ask, why are you doing this? Oh, bro, don't worry. Just do it. What? What you mean?
That's
And
kind
like,
of how physical therapy gets prescribed now. You have some kind of pain, and the painkiller is not enough. You have it for longer than a few days, and doctor's like, "All right, off to PT with you," and you enter the PT mill, and you go through all the standard stuff, and you come out the other side, and you're like, "Okay, well, I just wasted 4 months and so many copays, and I'm back at the doctor." And they're like, "All right, let's do the next thing now."
yep. Yep. And it's just a checklist. Okay, did this work? Yes or no? No. Okay, let's take it one step further. Did this work? Yes or no? No. Okay, now let's pump up the drugs. Did the pump up drugs work? Yes. Shit. No. Okay, surgery? Yes. No, it didn't help. Shit. Okay, what do we do now?
That's the really frustrating part, because after you're done with that, usually then, and you see a lot of people that have also had surgery, right, for their issue, and they come after the surgery, and it's like, well, I still have this thing. What do I do now? The doctor's out of options. There's nothing more extreme for
This
you to
is the most
do.
this is the most frustrating goddamn part, right? And you're absolutely right. I have patients who've been through multiple surgeries, and because they go in, they go, oh shit, I kind of messed up this surgery. Okay, let's just redo it, and then do a second surgery, and then they go, oh well, that got better, but then there's this other thing we have to, okay, and then do a third one. But at what point is the like clown world situation that's going on stops? And again, this is not the patient's fault. Not in the slightest. This is not the patient's fault whatsoever. Because again, it's not their job to know. They're going to a place which is a licensed, registered place, hopefully, preferably, probably. And they're looking for they're looking for help. And they go, hey, this is my problem. Dr. X, can you help me? Yeah. Hop on the table. Let's open you up. Right. And it's very frustrating when these people go for the surgery because all the other options, the bullshit physical therapy has failed. The bullshit chiropractic has failed. The drugs didn't work because they don't address the problem. They just cover it up. The injections didn't work because they made them feel good for about a week, but then the problem either came right back or even got worse. And then surgery is the only option, but the surgery may fix the structural issue, but the structural issue may not be the thing that's causing you pain. And then you're done with the surgery, you're done with this whole freaking process, and you're still in damn pain. And do you do? What do you do? Well, I mean, we fix it, but but this is the major frustration. And then people don't trust the medical system. And worse yet, if they don't find someone like me or find someone like Uriah that works here with us, then they're kind of to them, they're like, all right, well, I guess I just have to live with this. And then someone's quality of life drastically goes down because now you think, okay, I'm just going to be stuck in pain for the rest of my life, which may be another 40 to 60 plus years.
Well, there's a huge industry around, physical therapists going to people's homes, and they don't, this a lot of this is home care, a lot of this is for, um, older people, but it not it's doesn't necessarily rule you out from getting better. So what people, what a lot of these therapists that do home care do, they come, they don't actually help you get better, but they modify your environment so that now you can learn to live with your system, with your issues. And now you have to modify everything around your home to accommodate your issue instead of actually working to solve the problem.
This is a very frustrating process. This is a very frustrating process. This is the whole thing. And, whether it's the extremes of what we're talking about now, or, just even when patients come to me and I ask them, hey, so like, what have you done before? And they're like, oh, well, I've been going to physical therapy or chiropractor. I had a patient who told me they went to the osteopath doctor and they went through 100 sessions. 100 sessions. 100 sessions. 100. And they barely had any change. I came in and rocked her world in 6. 6. 75% down. Decrease in pain. This makes me very angry. I'm glad I can help. I'm happy about that. That's awesome. But what the hell? I mean, come on. Come on, really? And again, this is not her fault.
This is a systemic problem, though, that doctors come out of school, PTs come out of school, chiropractors come out of school, all hopeful, let's help. And then they enter the system and they get trained in a lot of these, mill type places that have a one size fits all approach to everybody. And then, quality of care, skills go down. If you, in this case, I think if you don't lose them, you lose them. Your experience,
yep.
If your experience goes down, you don't learn new things. And then, okay, you're a therapist. You've had, 10 years of experience, but 10 years of experience doing what?
Bullshit. Yeah.
Remember, keep it PG.
Sorry. BS. Yeah. So again, just because this kind of thing we can talk about all day. I mean, listen, I had so many patients over the last 4.5 years or so, and the amount of people who've told me about their previous experience. I mean, just this morning, I had a patient who came in with knee pain, like primary knee pain, but she also had numbness and tingling in her feet. She also had hip discomfort and hip pain on the left side. She had a little back pain across, and she went to therapy and she went through I think we said like 10 or 15 sessions. No real change, no real improvement. And I pretty much guessed her entire treatment plan. Like, I was like, let me guess. Here's what they had you do. I got it all. The whole treatment plan. And you know why I was able to guess it? Because it's the same thing everywhere. I can guess the same thing of what happens in just about every typical chiropractic place. Now, again, I want to preface this by saying that I know fantastic chiropractors who do not run to adjust you, which is huge. I mean, amazing, right? They do not rush to adjust you. They focus on that progressive movement program. They focus on ways to help encourage, educate, motivate, and push to include more movement, not exclude it. They push you to help actually know more about yourself so that you're not chasing your tail in the circle of fear and anxiety, where you want to do it, but you're afraid to, you're nervous to, you're anxious to, you don't want to do it, you're not going to do it. You want to do it, you're not going to do it because you're afraid of it. We got to break that cycle. But that cycle can only be broken by providers who choose to work that way.
And there's I think what Danny said is absolutely right. There's a lot of really good providers, PTs, chiropractors, doctors out there. If you find them, cherish them, go visit them. Don't let them be bought up by these giant hospital systems and turned into some kind of mill.
Give me some
Um,
chocolate or something. I like chocolate, by the way.
they definitely exist. And if you have trouble finding them, you have to window shop. Go, call up a bunch of different places, ask questions. A big red flag for a lot of places is if you don't get your questions answered, if you don't have give if not given the time of day to get your questions adequately answered in detail, right? And people are like, "Oh, don't worry about it. Trust us. We got you." Give you very superficial, like surface level answers, and then have to run to the next patient. Usually a bad sign. Um,
Yep.
but
And and we're gonna have guests on the show very, very soon to showcase just like what kind of good people I'm talking about. And we're gonna get into really cool topics and really talk about how do they do things, how do they approach patients, how do they actually go about the whole treatment process. Because it's one thing you hear from me, and you hear about Eric's experience, which is good. You get the provider and you get someone who was a patient, but I want you to hear from other providers, and like we're gonna do actual interviews with them so you can get an in-depth experience of, okay, like what does Danny actually mean when he says this? Oh, well, why don't you hear from Joe the chiropractor, or why don't you hear from Debbie the PT, or why don't you hear from Michelle the doctor? And like we're gonna be doing that. So it's gonna be pretty cool coming up real soon, and we're gonna make some announcements on that. Um, Eric, do you feel like there's anything else we need to cover? We can jump into some questions.
yeah,
Uh,
let's jump into a couple of questions. If you have a question, uh, post a comment. Leave it for us, and if we don't get to it today, we'll try to get to it, tomorrow or the next show. But if you've got questions, put them in the comments. The first question we've got is home remedies for tailbone pain.
So, it depends what's going on down there. Uh, so, there's so many things that happen with the tailbone, and what may feel like a tailbone, but not actually the tailbone. Um, so it really depends what's happening. There's so many muscles that kind of attach in and around it. So this one's a little bit hard to answer, just because, like, is it actually tailbone pain or is it just something else? Like I have a lot of patients come through with tailbone pain, or like sacral pain, right? It's like the area right between your pelvis, like that middle bit. The tailbone is right under that, but that's that middle bit that's like, or like when people say, "Oh, I have SI joint pain," right? And this is another pet peeve when someone says that they can adjust your SI joint. Ooh, buddy, I want to put their head through a wall and then put my head through that hole that they just made, because that is the most ridiculous thing you could say. And again, this is coming from the provider, not obviously from the patient. But like when a provider says that, or when a patient rather tells me that the provider did an SI adjustment, SI joint doesn't move. Anyway, what I would look into is the strength and integrity and stability of the muscles that line your spine. So your ability to sit up nice and tall, or to bend forward with a straight back. I would look into those muscles. I would look into the muscles that are responsible for rotation in your hips, turning the legs out or in. So it's really hard to give you a remedy, especially when this is the only information I have. Home remedies for tailbone pain. There can be so many, or so few. Like if you had a tailbone fracture, for example, like a coccyx fracture, there's really only one way to fix that, and it's kind of internal work. So seeing a pelvic floor therapist would be a good idea. Uh, so yeah, again, there's possibilities are endless,
All
and maybe
right.
not.
So then let's move on to the next question, which is
Oh, and I just
actually,
want to say hi to Seth, because I see Seth commented here. I just want to read out what he wrote, because this was in relation to what we were talking about earlier. Hey, Seth. So he wrote, with my partner's chronic pain, she visited an excellent chiropractor once, and then went back a second time where she was convinced against her better judgment and against her direct request that her neck should be adjusted. And that adjustment caused incredible pain. And when we found shortly after through an MRI that she had a herniated disc in her cervical spine. And then Danny saved her life and mine. I miss you guys. Miss you guys very much. And then he also wrote, very good point as well. When you're a hammer, every problem looks like a nail, right? So if you're stuck to just constant adjustments, you're gonna adjust everybody. It's kind of like there's a really funny phenomenon that happens. Like it's when a PT goes for continued education in some kind of manual skill or some kind of new therapeutic technique, suddenly everyone needs it. Everyone needs this technique. Everyone's got to do it. Do they really, or is that just like what's fresh in your mind, and that's what using people as target practice?
Well, I mean, if that's kind of like if you go to a surgeon, right? Every solution is going to be surgery. If you go to if you go to a really good surgeon, they might be like, okay, you should try this first. You should consider this first before we go down this route, and they'll give you your options that they've had patients go through where they've had good experiences, but they're not going to jump straight to the surgery.
Right. You got to be objective. And, sometimes a patient tells me like they went to a surgeon. The surgeon's like, yeah, I'm not operating on this. Like, you don't need surgery for this. I love those surgeons. I love that. That means they're objective, which is fantastic. They are actually telling you the true advice. Right. So that if you find someone like, look, sometimes someone does need surgery and someone needs to be told they need surgery. There are times when I've told someone like, hey, I don't think I'm the right one for you. I think maybe surgery is the right option. Or I think you should go to a rheumatologist. Or hey, I think you should go to a cardiologist because I think that there's something in this that smells fishy. Right. So something is not right here. Like that's just a sign of a good provider. Right. If someone needs surgery, they need surgery. If someone doesn't need surgery, they don't need surgery. Right. And that goes for your arthritis, your meniscus tears, your ligament tears. Like surgery is not always necessary. There's very few. Maybe once. I'm thinking about it now. I don't think there's anybody that has come to me with arthritis that needed surgery. Maybe one person in the last 4.5 years. And I have seen a lot of arthritis cases over the last 4.5 years. I don't know what the percentage is, but every week, I see multiple people who have some form of arthritis, or they've been told that that's the source of their pain, whether it's their knees, their hips, or anywhere else.
Yeah, arthritis, is going to be the topic of a whole nother episode. You can go real deep into that, and the misconceptions and like misinformation that's being spread out there.
Yeah, it's a deep down rabbit hole.
Yeah. So we got one more question. That's actually on topic for what we were talking about in the beginning. Can bulging discs be reversed back to normal?
Yeah. Now, I love questions like this because this I can answer confidently and comfortably. So disc herniations are very common, first of all. And like I was talking about earlier, they have a natural process of being kind of going back into place, right? That's the old science is that once you have a disc herniation, it's a disc herniation for life, and there's nothing you can do about it, and you have to live your life around the disc herniation. I cannot tell you how many patients have been feared into this way of thinking, wrongfully, might I add, wrongfully, because that is false, old, outdated, lazy information. So when you have a disc that is herniated or bulges, it's the same. That terminology is the same. It's interchangeable. Herniation, bulging, it's the same stuff. You have to, like I said earlier, you have to move. You have to understand what else is being affected for you. 10 people can have disc herniations and have 10 completely different symptom production, meaning some people can have pain just in the low back. Some people can have pain in the low back and hip. Some people can have pain or pressure in the low back and terrible symptoms in the feet. and so on. There's no there's distribution patterns, what is common or typical, but that does not mean that that's what it is every single time. And so it's important to understand, okay, like what is a disc herniation actually affecting? Also, just because you have a disc herniation doesn't mean that that's the cause of your pain. So if it's a fresh injury, is a disc herniation pressing on a nerve or is it not? Because you can have a disc herniation and zero pain. Also, if you had a disc herniation, say, a year ago, right, or 5 years ago, the chance of that disc herniation being the cause of your pain is very slim to zero. Because, like I said, over time, the disc herniation can and usually does fix itself. There's a few exceptions, of course, where sometimes it doesn't happen. There's no absolutes in medicine. But for the most part, especially the patients that I see, when they come to me 2 years post, 5 years post, 1 year post, and they're like, "Hey, I had a disc herniation a year. My disc is herniated. Like I have pain from that." I'm like, "Actually, you don't." We do the evaluation and we find out that after the evaluation, it's actually not the disc herniation. It's actually what I just said a moment ago is the things that the disc herniation caused, the trickle down effect of what happens to the body. That was the problem. Disc is fine. Disc is chilling. You got a good spine. The things around it are kind of not doing what they're supposed to be doing, but otherwise your spine is good. So to put it in short, yes, you can have a normal back after this.
All right, great. I don't see any other questions right now. Should we call it a wrap?
Call it a wrap. It's a good wrap session. So hope you've all enjoyed this episode. And again, like I said in the beginning, my goal here is to educate, inform, to question, to help you question and make better decisions for yourself. To make the best possible medical decision for yourself is the goal of this. And this is why I'm on every platform. Just about every platform that there is, I'm on it. And it's because I want to spread this message to the masses, and I want to make sure that people are making good decisions for themselves and not basing it off of false data or not staying with a provider when that provider is not the right one for them and is not helping them push forward. So all I want for all of you is to be happy, to be healthy, to be moving and grooving, and to make sure that you have the right resources of information to be able to do all those things. So much love to all of you, and we'll see you again tomorrow. Eric, thank you for joining us today. We'll see you tomorrow too.
Yeah, always a pleasure.
Always a pleasure, my treasure. All right. And with that, done. See you guys next time.